Using the blood pressure machine at Stowhealth here is really easy. The patients receive their letter from the data team inviting them to come in and have their blood pressure taken.
Good morning.
Good morning.
Good morning. I've come to do my blood pressure reading.
Okay, if you'd like to use our machine over in the corner there and then come back to me.
Thank you.
Thank you.
They go over to the automatic blood pressure machine, they do it themselves, they fill in the form. The blood pressure machine we have here at the surgery is very easy for the patients to use.
Well, the machine that I've used is a very convenient machine. You can sit comfortably at it. I prefer it to the smaller machines, and I find it quite easy to use.
Blood pressure monitors we use at Stowhealth are oscillatory blood pressure monitors. Essentially what they do is they blow a cuff up around the patient's arm, and as the cuff deflates, it senses pressure changes underneath it, which relate to the patient's own blood pressure. We can capture their systolic and diastolic blood pressures, which are two really important bits of information that we use for clinical decision making.
It's a system that the health centre have brought into being, which enables us to come down in our own time and when it's convenient to us to have our blood pressure taken.
Having access to BP monitors at Stowhealth has really helped the patient experience. People are more involved in their care, it's much more convenient for them. I think it's making that linkage between the medication that we prescribe and the impact it actually has on their blood pressure, and how that in turn is hopefully helping their well-being.
Here we are, it's my results.
Okay. Thank you. I just need to check those against your records and my protocol. Bear with me.
If they're below the protocol, they then don't have to do anything else. If they're above, we either arrange a phone call with their doctor to discuss the results, or arrange for them to have a blood pressure monitor for 2 days. And then if it's extremely high, we then pass it on to the on-the-day team, who will see them.
Is patient diabetic? No, you're not. On treatment for high blood pressure, yes. Your target is 150/90 and you are well within target. Repeat again in 6 months. Thank you.
Thank you very much. Thank you.
If patients are being treated to target, that information can be shared with their GP and their medication can be reauthorised for a further 6 months.
Yeah, everything seemed fine, the readings were good. I'll move your medication review forward by about 6 months, and we'll write to you in about 6 months' time.
We like to innovate, and we like to try and do things in a way that's better for us and better for our patients. I think using the blood pressure monitors is a great example of that. But we've also got some externally validated evidence to demonstrate that our achievement of treatment standards has improved enormously and continues to be significantly above our local averages and national averages.
Pretty quickly we increased the number of people getting these checks from 90% up to 96%, and that level's stayed pretty static over the last 6 years.
I think this is great for us as an organisation, but more importantly it's great for our patients.
It's a very well run outfit, and I quite enjoy coming here, surprisingly.